Senator from West Virginia.
Mr. President, I agree with everything that's been said. I agree that basically we should never have left here Thursday night. So many of us could maybe drive home. I drove home, was able to drive back. So many people were put in harm's way by putting on an airplane. We don't have the youngest crowd, as you might know. I think our average age is about 62 here. And to put them and their families and basically the people they work with is a danger also. But let me tell you what we're talking about here. We're going to come to the aid of the economy of this state, of this country. I have no doubt Democrats and Republicans will come together to take care and help people. I hope they realize the people that really need help are the people that cannot make it from one week to the next, let alone one paycheck to the next. I was out last week just in D.C. and I talked to a young waiter, and very, very nice young man. I said, "What happens if you have to go home for 2 weeks?" He says, I'm finished. I can't make it. I can't make my payment. I can't make my house payment. He says, I can't make my rent payment. Can't make my grocery payment I need. He was done. That's how worried he was. And he said, I'm glad someone asked. No one's asked me that question. These are the people we have to worry about. But I want to bring to your attention one more thing. My state, as of 2:30 this afternoon, didn't have one reported case. Now that's great. That's wonderful. I pray to the good Lord that that is the case, that we have none. But let me tell you the thing that scares me. I have the most endangered population base in the nation. The Kaiser report came out, showed the state of West Virginia the most endangered of all states with the most vulnerable people. I have over 720,000 elderly. I've got over 220,000 that are critically ill under 60 years of age. If you put all this together, out of 1,800,000 people, I have over 1 million that could be absolutely, totally devastated by this virus if it hits. And we haven't shown one case yet. Out of the 1,800,000 people I've told you about the 1 million that are in a vulnerable situation, we've only had 84 tests. 84 tests in my state as of 2:30. Now 80 came back negative. 4 is unknown as of 2:30. How can you tell me? I mean, I'm surrounded by 5 states in this wonderful little state of mine, West Virginia. These are the most beautiful people in the world. They've worked hard, but they have a lot of illness, a lot of respiratory illnesses. And they'll be the first to be attacked. If it hits my state and we are not prepared for it, because basically if we don't even have the test to identify who is ill, who needs these treatment in these centers and needs the health care, the hospital care, what do we do? I don't have the ventilators. I don't have the respirators. I don't have anything available to that many people that are that vulnerable. What do we do? So I know all of the financial aid we're talking about, all the help that we're going to need. We better concentrate on how we find a cure, how we basically take care of the people most vulnerable and be able to protect the people of America first and foremost. They're scared to death. I'm scared. I'm concerned. I'm afraid that my state of West Virginia is falling into a lapse to where they might think, oh, well, we're protected. No cases reported. We're in good shape. I pray to the good Lord that's the case, but my gut tells me that's not. We just don't know. Yes, sir.
If Senator would yield for a question through the chair. We have the Families First Coronavirus Response Act that passed the House of Representatives early on Saturday morning, which we could consider and have in the past on a parliamentary basis, which I called for and others have joined, that we move on this and move on it quickly. Senator from Massachusetts has expanded it to other areas we should be considering. While we're here, let's get some work done. But among the things included in this is the testing. And you said 82 tests in your entire state?
1,800,000 people in the most vulnerable state in America.
And it's obvious. You cannot measure the actual rate of infection until you have enough tests of those who are suspicious, who have a fever and a cough.
Have you seen the map of the United States, Miss Senator? If you've seen the map, West Virginia stands out. Doesn't show any
blot.
And I've seen it. How could that happen? It happened because nobody's tested.
We face the same thing in Illinois with 12.5 million people. We were testing 360 a day. 360 a day for the entire state. Ridiculous. And so governors talked
total.
I know. And so the governors told me, we really don't know how many people are infected. We don't know the rate, whether it's going up or if it's going up at what rate, whether it's in certain areas of our state and not in others. So if you don't have testing, you don't have knowledge, and you can't fight a pandemic. And I would just say to the senator, it was the highest priority in this bill passed the House of Representatives on Saturday.
We should have been here Saturday.
We should have been here Saturday. We should take it up today. What are we waiting for? For goodness sakes, we got to do it. The other thing is food assistance, and I know your state struggles. There are many people, as you said, it's not paycheck to paycheck, it's week to week.
Oh, yeah.
Some of them qualify for food stamps, the SNAP program. It's
Let
something
me tell you what we were able to do on that. We sent a letter. I sent a letter last week immediately to Sonny Perdue, and he answered immediately. We were able to get all of the kids, because we have so many children in West Virginia that rely on their breakfast and their lunch nutrition from their schools. We're going to be delivering. The school's doing that. The state's taken some steps to shut things down. Schools have been shut down. We've said no more, community gatherings whatsoever. They've done all of the things they're told to do. We just don't know where the virus may be, if it is there, and how it's going to affect.
So it
And
starts
that's what
with
we're
testing.
concerned about.
It starts with testing. It's food assistance. There's also additional Medicaid money coming back to the states.
Correct.
I'm sure the state of
We're
West
gonna need all
Virginia,
that.
like Illinois, desperately needs it. I was surprised to learn today that the capacity of hospitals in the United States is less than 1 million patients, fewer than 1 million patients. Of a nation of 350 million people, we have a hospital capacity of less than 1 million, and when it comes to the intensive care units, a much, much smaller number than that. So that's our fear. If this goes rampant, it could overwhelm our hospital system. Certainly Medicaid money, back to your state and mine, in this bill that passed the House, should be authorized tonight. We should vote on this tonight. to
The
send this
economics of
Medicaid.
this whole thing right now is, first of all, should we know who's infected, where the infection is going, and how rampant this would be? We don't know yet. Next of all, who's the most vulnerable economically? The people that work day to day, paycheck to paycheck, week to week. That's where the relief
Medical
needs.
leave.
That's
unemployment
exactly. We've got to
compensation.
do some things and do it quickly. And if this thing doesn't come up, we should sit here and protest until it does come. There's no reason we can't do it tonight.
There is no reason. And
And
if the president was credible, and I believe he was when he called this a national health care emergency, we ought to act like
Well,
it.
today he recognized it and came forth and basically said today in a press release that I listened to, that basically acknowledged the threat of what we're dealing with and the enormity of what we're dealing with. For the first time I've heard basically the concern that we have that this thing is bigger than any of us, but all of us together can be able to fight this. But I would ask the majority leader, Mr. Majority Leader, we should have stayed here. We didn't. We're here now. Let's do it.
Let's do it and
Let's
do it
do it.
thank
No blame. No blame. Let's just do it.
I thank
Thank
the
you, Mr.
Senator.
President.
Mr. President.